Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hello, listeners. Thank you so much for joining us again. Today we have, he's not really a guest anymore to you all because he's been on our podcast quite a few times now, but we have Hiep Nguyen, our PA, who's been with us for the last couple of months, right, Hiep?
Yeah, couple of months.
Yeah, and today I invited him back because he brought up such an interesting topic that I think all of you would really benefit from hearing about. It's called adverse childhood experiences, or in other words, ACE.
Yes.
Okay, I got that right. So this is an interesting topic for you, Hiep, because you did your final thesis on it, or how do you call it?
No, I actually just stumbled upon a TED Talk.
Oh, okay.
About this issue.
Okay.
I'm in my PA education. Okay. I got to become more of a proponent of preventative medicine.
Okay.
Meaning I need to prevent something from happening. What do I do? And ACE is actually one of the exposures that everyone experiences. And there's a lot of connections with that to how we develop in terms of our brain development as well as our health outcomes in the longer run.
Okay.
So that's kind of the reason why I got into it. I stumbled on it, talked to a few people about it, and in my pediatrics rotation, we talked a little bit about it too because it affects children early on and kind of sticks around throughout their life. So.
Interesting. Okay, so let's dive into ACE, adverse childhood experiences. What are adverse childhood experiences?
Yeah, surprisingly, not a lot of people know about ACE, and it's something that exists for a long time, and not a lot of people know that it plays a role in a person's health, so to speak. And to define adverse childhood events, there's kind of three parts to it. The first part is, I'll read the whole definition here. It's traumatic or stressful events that occur in childhood that can potentially have a negative impact across the life course in the absence of resilience and a supportive relationship. So breaking it down to the three is it's a stressful or traumatic event early in childhood. Second, it's negatively impacting the individual. And three, this is all happening in the absence of a supportive relationship or a resilient attitude in the person. Okay. So that's kind of the idea.
Okay. So how early would you define as early in childhood?
From infancy.
Wow.
From the age of 0 to 5.
Okay.
Is when the brain develops a lot.
Okay.
And they use the term neuroplasticity, meaning how much the brain can change and gets formed into what it's supposed to be as you grow.
Okay. Wow.
Yeah. During that time, it has high neuroplasticity, meaning it can change very easily.
It can change for the good or for the bad, correct?
Exactly. Okay. That's why kids learn so fast, right?
Yes,
they pick up things like quickly, super quickly, and that's kind of the early age when that happens.
Okay, great. And what are some examples of ACE?
Yeah, some examples. There's a lot. Okay. And it kind of scares me a little bit when I read into it and it's like, oh my gosh, I had that or I had that. So there's three categories. One is abuse, neglect, and household dysfunction. So under abuse, there's physical abuse, there's emotional abuse, and verbal abuse.
Sure.
Absolutely. Kind of similar in neglect. There's physical neglect and emotional neglect.
Okay.
as well. And then there's other things like in the household, mental illnesses. Someone in the family is incarcerated or went to prison.
Okay.
A mother who was treated violently. Substance abuse in the family, divorce in the family, death of a relative, like death of a parent is a huge one. And they're coming up with a lot other adverse childhood events as we speak, really. Like homelessness is definitely one. It's become one too. Someone asked me one time, is video games an adverse childhood event? And, that's still something that I'm still figuring out.
Like violent?
Like violent video games,
Video
yeah.
games.
It can influence different behavioral development.
How about COVID?
COVID,
Like,
Yeah.
kids not being able to go to school
Absolutely.
regularly, and they're seeing everyone wearing masks and
yeah.
things being locked down, like, oh, don't
Yeah.
touch grandma because you could kill her, with those types of disruptions affect children.
Yeah, I think so. It does. It kind of takes out the norm of how we are as social beings.
Yes.
Right. I remember trying to like smile at like a little child, and the child was like, "What are you doing?" Because they couldn't see me behind my mask.
Yeah.
So they
yeah.
don't know what that social interaction means, and kind
Yeah.
of same thing with like a mom to her baby. Like even in public, if she can't see that smile of the baby probably won't know what to do per se. But I guess also like in terms of neglect, like there's some sense of social neglect that they won't be able to interact with their friends or with other people who they normally see. So I think in a way, COVID and the ensuing practices definitely does affect the child in some ways.
And unfortunately, we won't know how much it is affecting each child, because each
Right.
child is different due to their ability to be resilient or not, right?
Right.
We won't know this until many, many years later, many decades later, and how that transpires into their health. So what is the impact of ACE on a person, and then connecting it so this sounds like a very like mental health kind of start, and then it affects your body, correct?
Yes and no.
Okay.
So in the beginning, I think a lot of people would anticipate thinking, yeah, these kind of experiences will lead the individual to develop ill behaviors that could lead to poor health outcomes. In the mid-90s, Kaiser Permanente, along with the CDC, did this study where they took a bunch of data from people. I think it was like in the thousands, where they take health outcomes and correlate that with numbers of adverse childhood experiences that a person had in their lifetime. And they noticed that the more ACE you have, the higher and the more likely it is for you to develop like liver disease, heart disease, mental health illnesses. So it's that type of exposure that can lead to it. And a lot of people at the time kind of thought, yeah, these experiences probably lead to such behaviors that can lead to heart disease, like using alcohol or substance abuse and all those kind of behaviors. But more recent studies have shown there's actually a direct connection between ACEs and the number of ACEs you have to the health outcome that one can develop. So it completely bypasses the behavior part. So to speak, if you have one or two experiences, ACEs, when you're young, and you don't develop any bad behaviors from it, you can still have some increased risk for developing like physical illnesses, like heart disease, stuff like that. Yeah.
So interesting. Okay. So, for our listeners, if you haven't been aware, Hiep is Vietnamese and I'm Vietnamese. Both of our last names are Nguyen, but we are not related. There's just a lot of us. And
many.
Yes, a lot. We're not related. But it's just so interesting because I'm thinking, as you're talking about this, I'm thinking about my family And, they're the original boat people. And my mom was the oldest of 7. And it's just so interesting just hearing about this is thinking about them and the trauma that they've went through, escaping communist Vietnam and coming here in a new country and having to start all over. Like, what are those types of events that happened in their lives that has transpired now into adulthood? And that wasn't something that they wanted or asked for, but it happened.
Exactly.
And it's like, okay.
Yeah.
That's very interesting.
But the thing about it too is that they did something about it. They escaped the tyranny that was oppressed over them. So in a way, they have that resilience to be able to, avoid or escape that oppression. But at the same time, they left their motherland,
exactly,
their home.
Yeah.
So in a way, that can affect me as an immigrant. That definitely has a factor as well.
Yeah, I think there's one thing about, when the war broke out and all of that stuff, like there's something about our Vietnamese people that you really nailed, is that we are very resilient, which is very interesting. Because, we're tiny little people, most of us. Not so much for my grandpa, he's huge, but like, it's interesting when you're in that survival fight or flight kind of mode, does that slowly releases itself through the years?
Right.
And how does that affect mental health? How does that affect?
Exactly. So how, like, all these events, like all these ACEs, how it works, it kind of changes how the brain develops. There's a lot of focus on talk about the stress that comes from these experiences. And they define it as toxic stress.
Okay.
So if you ever heard of the flight or fight response, I think the brain, whatever it does, whoever developed it, whoever created that idea, it's genius. So if you're in the woods and you're hiking around like we do here in the Pacific Northwest, you see a bear. What is your instinct going to tell you to do?
Shoot it.
So you're going to fight. If you have something with you.
I mean, that would have been my instinct, but maybe that's not the smartest thing to do.
I mean, it's one of the other, right? Some people will run. Some people will fight it, like you. Maybe shoot it, right? I'll probably go hiking with you more often. But that flight or fight system is genius. It's great. But only if you're in the woods and there's a bear. Now, when it comes to ACEs, just pretend every time you go home, that bear is there with you.
Yeah. It's that continuous trauma.
Exactly.
It's not a one-off event.
Right.
It's
It's continual. It's gonna, every day you wake up, you're like, oh, this is still happening.
Okay.
In a way. So all those examples of ACEs I listed can be considered as a toxic stress, right? Neglect, abuse, and those type of examples. Yeah. There's definitely positive stress for sure that can help someone, change like their surroundings, and in a way that stress can go away once managed.
Okay.
Toxic stress tends to linger a little bit more.
Okay.
Yeah. Okay. And there's a lot of studies on like the stress hormone, cortisol, and currently there's a few small studies. This information I'm sharing is about like a year ago. Okay. And there was a study that kind of correlates that, there is a decrease in cortisol levels. The higher the ACE score, the lower the stress hormone. You might be like, shouldn't there be more stress? So the way that I think about this is that early on, there's so much stress that the body has kind of produced
a resilience to it?
Not in a way, a resilience, but also like a tolerance.
Oh, like callous. Like you get kind of like dull to it.
Exactly. It's like,
oh, okay.
it's quite interesting. And there's different molecules, different hormones that they test that kind of shows that correlation with the stress level. Like the more ACEs you have, the more certain protein that you produce that's kind of related to stress. And in the study I just mentioned, people may have decrease in the ability to create stress hormone because stress hormones in that flight or fight response helps you to do something, right? So if someone now has a lot of ACE growing up and they are faced with a stressor in their current time, they might not produce enough stress hormone to help them do anything about it, if that makes any sense.
Yeah. Wow. That's very complex.
It is very complex, but it's so interesting to me because when I actually did it on myself, I have more than 4 ACEs.
Wow.
And they said here, let me pull that number up really quick.
Yep.
Each ACE score increased the likelihood for behavioral issues and drug addiction 2 to 4-fold.
Wow.
Each one.
Wow.
So it says here a person with 4 or more ACEs is 12 times more likely to attempt suicide, 10 times more likely to use injection drugs, 7 times more likely to be an alcoholic. That's behavioral side. But on the physical side as well, it's 2 times more likely to have heart disease, 2.5 times more likely to have a stroke, twice more likely to have cancer. And those, it's just pretty much increasing your likelihood of developing poor health outcomes down the road.
Wow.
Which is quite interesting.
Wow.
Yeah.
That really makes me pause and think about the people we interact with on our daily basis or the patients that we see here with certain health issues that come up. And, we're so quick to look at people in our community. Sometimes we're so quick to judge and say, oh, that person is engaging in those types of addictions or habits because they're choosing to do that. And sometimes we need to take a step back. And I think that's something that our medical providers do so well here is they take a step back and they say, okay, we understand that some of these things that have happened to you or some of these health issues that have happened to you is out of your control.
Right.
Right. And that really makes you pause and extend some grace to people that are sitting in front of you.
Right. And in a way, we're hoping to put the control back into their hands. And the biggest thing is being aware of these experiences growing up and not only to know it, that it happened, but embracing it. That is kind of part of who you are, that made you who you are. And then at that point, we can start doing something about it.
Yeah, using those events to empower you by being aware of them and then moving forward to changing them and not having them define you moving forward. Yeah. Correct?
And in this TED Talk, it was given by Dr. Nadine Burke-Harris. She's a great public speaker. And she said, and I'm going to quote her, which is really great. She says, "I don't think forgetting about adversity or blaming it is useful. The first step is taking its measure and looking clearly at the impact and risk as neither a tragedy nor a fairy tale, but a meaningful reality in between. Once you understand how your body and brain are primed to react in certain situations, you can start to be proactive about how you approach things. You can identify triggers and know how to support yourself and those you love."
Wow. That's very powerful.
Yeah. I found that quote really inspiring for me.
Yeah.
Because that's kind of changed how I view my patients, how I view my family. And don't be so quick to get upset at them for certain things that they do and just be a little bit more embracing and understanding.
Yeah. That makes me think of my mom and how she I don't know about your moms out there, but she always keeps containers. She keeps it down in the basement and it's always just just in case we have to escape the war, I need to grab a container so that I can hold my things. And I'm like, why do you need 10 yogurt containers? And that just really is interesting that you said that, because like she's always in fight mode. Like if she had to escape another country, she had 10 yogurt containers to put our stuff in. Like that's so interesting.
And you make a really good point there. She's always in flight mode.
And
that's what kind of ACEs do to you. It's like you're continually exposed to this stressor. You're continually in like a response. So it's either you fight or you flight.
Yeah.
It's really interesting.
Right. So that's why it's so important to identify ACE. To identify ACE in your patients, or how you is that how you approach your patient care? Is like when you meet a new patient, is that kind of how your approach?
Yeah. I mean, seeing my patient first, the reason why they're here, what is it? And kind of just help them resolve their like immediate issues, their medical issues, and then getting to know them. Not just like, oh, you have this illness, go do this or that. I want to get to know them a little bit more. If we're going to have a provider-patient relationship, I think it's more than just medicine. I think it's a cooperation between two liked people who use each other and work collaboratively to obtain a certain goal.
And to get healthy.
That's the goal. To get healthy. Exactly. Okay. I want you to be healthy. You want you to be healthy. Let's work together and do that.
Awesome.
And getting to know one another, I think, is really important.
Yes, absolutely. What can we do about ACE when it already happened to us?
Yeah, that's the tough question, is like, what can we do? And kind of like I just mentioned and quoted Dr. Brooke Harris there, is one, just be aware.
Sure.
And to be able to embrace those experiences that happen to you. I know that it's not going to be easy. Some people have very traumatic experiences and they choose to either just stuff it away, or embracing that, it happened. That's who I am. And hopefully when they do that, there'll be less judgment from others. And that's kind of how we can respond to it. The thing that's difficult with ACEs and kind of preventing it is that it's just not on an individual level. It's not on a familial level. It's on a community level as well as a societal level. Right. So being able to be aware of it for yourself, and if you need to, get someone to listen to you. Like we mentioned, this is kind of like in the mental health, behavioral health realm. So there are currently, therapists that does
counselors,
that. Counselors. Right. Because there's this therapy called cognitive behavioral therapy, where it's pretty much helping you think through your situations. And the research have shown that it helped with symptoms of depression, PTSD, dissociation, sleep, substance use, all that sort. There's a lot of different ways to help someone kind of embrace that experience that they have and to not let it overwhelm them anymore, as well as to overcome it as well. There's different ideas, different thoughts, like expressive writing, but studies have shown that cognitive behavioral therapy has been more effective than any other means to do so. And that's kind of like on an individual level when it's already happened to us. Most oftentimes, like, how can we prevent it for others? And most oftentimes, at least for me as a medical provider in primary care, it's going to be early identification, being able to see it, treat it right away, and just prevent further issues. And then on like a societal standpoint, it's going to come down to policies. So that's going to be a little bit more difficult. Dr. Brooke Harris said, this is not a treatment to fix ACEs, it's a movement. So
to be aware, to put it into practice.
And prevent. Exactly.
Very good. Very good. Well, thank you so much for bringing this topic up to me. And I'm so grateful to be able to share it with all of you, all of our listeners. And I guess like the main message is like, be gentle with each other, right? Like give each other a lot of room, a lot of grace, especially right now when it seems like our nation is going through a transitional time, individually within our own families. There's a pandemic going on. I mean, like all of those factors can really stress us out and can really prevent us from extending certain graces that would be easier in different times. And I'm so grateful to be able to provide a space like 3W to the patients that come into our doors.
Absolutely.
I hope that patients really know that we're here for them, and whatever adverse events that they've been in, we are not here to judge. We're not here to put a Band-Aid over the situation. We want to honor it. We want to recognize it, and we want to get you well.
Absolutely.
That's our primary goal here. And whether that's getting well physically, which is what we primarily focus on here, but we do have resources, mental health resources, and partnerships that we've developed through the years in the community that we trust and like. So if you have any questions, if you're concerned that, I might need to check in with someone that's a mental health professional, please give us a call. Please reach out to us and we can connect you with those resources.
Yeah, definitely. I think that's a great idea. And the whole idea about this is like being able to find the support you need, or even being the support that someone else needs.
Sure.
Like I mentioned, having that supportive relationship early on. And in a way, I'm trying to be that way for my nephews and nieces.
Yes.
Right. So it changes how I act now. So hopefully that can translate to my patients. And I definitely see that here at 3W. And it's been amazing to see Dr. Rutherford work with patients and hearing all the feedback from them too. So it's been great.
Awesome. Well, thank you so much, Hiep, for your time and your expertise in this. I'm sure there's, we peeled back one layer of the onion. I'm sure there's going to be more things connected to this that we can explore down the road, more topics connected to this down the road. If you have any questions for Hiep, please reach out to us and make an appointment and learn more. He's here for just a little bit while longer, so please take advantage of him still here. And learn more about how you can, I'm sure there's like a test or something, like, because you said there's like 4.
Yeah, it's kind of like a survey.
A survey. Okay.
Yeah, kind of ask you like, have you experienced, a divorce in your early life, or your parents have experienced divorce, or is there a death in the family?
Okay.
Like that.
Okay.
It's an inventory.
Awesome. Yeah. Awesome. Well, make an appointment, come in and see Hiep, and he can walk you through that since he's done it himself. So thank you so much for tuning in again. We're so grateful to have you listen and tune in, and so grateful to be able to extend these types of resources to you. Thank you. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.